by saying that we are moving on well. We also don't forget to thank you for continuously viewing and following our information. And the comments you have given, we have taken them positively, and we have gone to inform based on your comments. For today, Frokil Show wants to bring in a discussion on what we call lifestyle diseases and management tips. For today, Frokil Show is here to just bring in and highlight of lifestyle diseases and management tips. One would ask, what are lifestyle diseases? And lifestyle diseases are diseases that are primarily caused by unhealthy habits and behaviors in daily life. These include conditions such as heart disease, diabetes, obesity, hypertension, respiratory diseases, and some types of cancer. Often, these diseases can be prevented or managed with changes to one's lifestyle, such as improved diet, physical activity, stress management, and avoid harmful substances like tobacco and alcohol. Then we look briefly about the management. In other words, how do we manage these lifestyle diseases if already you are a victim? Management of lifestyle diseases requires both short-term and long-term strategies, often involving a combination of medical treatment and personal behavior change. What are the common lifestyle diseases? Number one, we have cardiovascular diseases or heart diseases, stroke, hypertension, and so on. Heart disease is often caused by a combination of high blood pressure, high cholesterol, smoking, excessive alcohol consumption, poor diet, and lack of exercise. And then stroke may be caused by a blocked or burst blood vessel in the brain, often linked to high blood pressure, smoking, or unhealthy diet. Number two, we have type 2 diabetes. Diabetes is often associated with unhealthy diet, high in sugar and processed foods, lack of physical activity, and being overweight. But I give a rider here that at times type 2 diabetes could be as a result of hereditary or genetic characteristics and not necessarily being caused by diet. I'm saying this so that those probably who have it may not necessarily be as a result of a lifestyle. Then we have obesity. Obesity is linked to many lifestyle factors, including poor diet, lack of exercise, genetics, and high levels of stress. Obesity significantly increases the risk of other diseases like heart diseases, diabetes, and some cancers. And then number four, we have chronic respiratory diseases. These will include diseases like asthma, chronic obstructive pulmonary disease. Some of the lifestyles that cause this is smoking and exposure to harmful substances such as pollution, poor indoor air quality, and occupational hazards such as spraying can contribute to chronic respiratory diseases. Number five, we have cancer. Note we are talking about some types. Many cancers, including lung, colon, and breast cancer, have lifestyle risk factors such as smoking, alcohol consumption, poor diet, and lack of physical activity. I also give a rider here that it's not all times that once a patient develops a cancer is attributed to lifestyle. Number six, we have mental health issues, e.g., depression, anxiety, and so on. This is as a result of chronic stress, lack of sleep, unhealthy diet, and sedentary behavior. And all these are linked to mental disorders. In other words, one has to avoid stress as much as possible. May it be occupational, may the stress be financial, or whatever kind of stress. Then one has to sleep well, and of course you should not be having insomnia or lack of sleep. Unhealthy diets should be avoided. Then we move on to management tips for lifestyle diseases. Having looked at a number of those diseases, then we look at the way you can manage them if you already are a victim. Number one, we have dietary changes. An healthy diet is crucial for managing and preventing lifestyle diseases. And the key dietary tips include: 1. Eating a balanced whole food diet. Focus on eating plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid highly processed foods, sugary snacks, and fried foods. Choose foods that are high in fiber, vitamins, and minerals, such as leafy greens, berries, nuts, and whole grains like oats. Number 2, reduce sugar and processed food intake. Limit consumption of sugary drinks, snacks, and fast food. Choose foods with natural sugars like fruit instead of processed sweets. Avoid empty calories. Foods with little nutritional value like sodas and candy. Number 3, we have portion control. Avoid overeating by being mindful of portion sizes. Eating smaller portions more frequently throughout the day can help manage hunger and blood sugar levels. Use smaller plates and bowls to naturally reduce portions. And then number 4, limit sodium and unhealthy fats. Excess sodium, in this case salt, can contribute to high blood pressure, while unhealthy fats, trans fats, saturated fats, increase the risk of heart disease because of cholesterol accumulation along the blood vessels. Cook at home using fresh ingredients and try to limit packaged or fast foods that often contain hidden sodium and unhealthy